So my outcomes. My first one was a webinar support group, part 1, and individuals who have a diagnosis of endometriosis. And this part 1 was essentially to identify the historical mainstream definitions and also discuss the most up-to-date definition, as well as identify the misconceptions and medical myths that depict endometriosis as just a bad period or a period disease. Lastly, I also talked about the complications that extrapelvic endometriosis has on our body. My next one was a support group part 2, host the returning support group members and introduce what an entry-level OT could do, as well as compare what an OT who is trained and certified in pelvic health and is a pelvic floor therapist. I interviewed a pelvic floor therapist who is a physical therapist, and they provided me with techniques and strategies that they use and they implement. They either present with tender points in their pelvic floor muscles, and they also present with incoordination in their pelvic floor muscles as well. So her role as a physical pelvic floor therapist is to provide education on lifestyle changes, body positioning, toileting education, and education on how to really provide those psychological approaches for anyone who is experiencing pain. Intended to educate the 2025 OTD cohort students and staff on the accurate understanding of endometriosis, as there continues to be a lack of medical professional curriculum with accurate information about endometriosis. My last one was a business plan